because it's got tremendous tools and services available to you to help you write business with HealthiestYou, like doing ROI calcs, running proposals. You can even check your commissions. All those things are at your fingertips in our portal. And so when they looked at us and said, you really focus on that small to mid-market, we tend to focus upstream. This is just a fantastic complement to each other. And the other thing they looked at is our capabilities that we bring to all of you. Jesse's going to talk about these capabilities in the webinar here. But all the things that we do to drive utilization that really differentiates us, the reasons you sell us to your clients, those are things that were very attractive to Teladoc. There's no secrets in the industry that HealthiestYou has industry-leading utilization. It's what we do, it's who we are, it's in our DNA, it's what we wake up and think about each and every day, that we want to get people to use our tools and capabilities and ultimately call the doctor instead of go to the doctor, which is going to lower medical claims for the employer, for the employee. It's really a win-win-win for everyone. And so they looked at that and a nice complement with Teladoc. So I couldn't be happier and more optimistic about how these two organizations coming together really, the old saying 1 + 1 = 3, I really believe that's the case of bringing these two organizations together. So where are we at from an integration standpoint? I want to give you a quick update on that. First of all, Teladoc has asked me to oversee and lead the broker distribution channel in the small to mid-market, which is what we all do. And so I'm very excited to take that position for Teladoc. So I will continue basically doing what I was doing at HealthiestYou, and again, I'm really thrilled to be able to do that. The first step is we are in the process of evaluating our territories, our salespeople. We're actually doubling our broker sales force from about 15 salespeople to almost 30. So the first task at hand is to really look at territories and people. There's plenty of brokers out there to serve, and we want to make sure that we have enough people in the right markets that we are serving all of you, our broker partners. So that's number one. Really looking at integrating our distribution to make sure that we have a consistent, a consistent message and a consistent sales force that's going to be calling with you. The second part of what we're going to be working on is our go-to-market strategy. We really need to think through what offering, going to look like. What does our product look like? What is the pricing? So we have work to do, and we haven't completed this. So I'm asking you for your patience, because it's going to take us a little time, and we want to do it right. And frankly, we want to get a lot of feedback from many of you. So we're going to be working diligently on our go-to-market strategy. And the one thing I think I can share with you with confidence is it's safe to say that Teladoc didn't buy HealthiestYou to not continue and use our capabilities and our services. Say it another way, we fully expect that we will continue to sell HealthiestYou just as we sell it today, with a consults included. If you want consults not included, we can do that today. But our platform, all the capabilities that we have, we are going to continue to sell those going forward. So I think it's very safe to say that is absolutely going to continue. What we want to do, though, again, is we want to be thoughtful and really think about, what do the products look like, and what is the pricing, etc. And our goal really is to have this completed no later than 10/1 effective dates. We want to be able to have this completed out to the market so we're actually impacting 10/1 sales. And so really, what does this mean? It means for the time being, it's business as usual. That's what we're telling our salespeople. We're telling the Teladoc salespeople. We're saying, hey, everybody, it's business as usual. Get out there, serve the brokers, serve the clients, work with people to write business. We've got a tremendous opportunity in front of us between now and 1/1. Let's take advantage of that opportunity and write as much business as we possibly can going into 1/1. And so that really is the message that I want to leave with all of you, and that is it's business as usual. Whoever you're working with, whether it's on the Teledoc side, whether it's on the HealthiestYou side, please, stay in contact with our salespeople. Let us know what we can do to help you write business. And, as I conclude my comments, I just want to reiterate, one more time, I believe this is an incredible, exciting opportunity for everyone. I think we all have an opportunity to write a lot of business with with new customers, to bring additional capabilities to our existing customers, to make the experience that much better for our customers, which ultimately is going to lead to more utilization and is ultimately going to lead to more savings, because everything we do at HealthiestYou is around lowering medical costs. And I think all of you understand that, and that's why you're on this phone today, and that's why you're writing business with us. So we appreciate it. I'm going to pass it back to Jesse now. And again, thank you for your time today. Thank you for your business, and we are really looking forward to continuing to work with you in the future. Have a great day. Jesse?
All right, thanks, Pat, and thanks so much for the comments. I hope that was helpful for everybody. So, let's get into HealthiestYou. I want to walk you all through start out with some high-level strategy. What do we focus on? What's unique to us in the market? Everything we do is designed to change behavior and drive people to a telehealth consultation or a video consultation, right? So as we're going through this deck, just think about what it takes to change behavior. And it's a combination for us of an awesome client success team. They play an integral role in educating employees, working with groups. So when you sell a client, they're not on their own. We're going to help them. We're going to support them, drive that engagement through education, and that'll come through a variety of channels. And in addition, some amazing features through a smartphone app and member portal, and all designed to simplify healthcare, but in addition, keep our offering top of mind so that someone remembers to connect with HealthiestYou when they are sick. So at their time of need, they're thinking about us. And then additionally, we've got some alerts built into our smartphone app technology, which we'll walk you through. But great ways to, again, catch somebody at their time of need, get them thinking about HealthiestYou. What all of this does is improves access to care, right? So it's a lot faster. We'll reduce claims from the medical plan. So if you're writing fully insured claims rated cases, level funded or self-funded cases, we can help you all greatly. If you're writing small group age banded cases, this is a great way to curb the cost to the employee, where the cost is shifted to the consumer of healthcare. Instead, now they'll have access to a doctor over the phone, sits really well alongside a high deductible plan or anything where the employee is out of pocket a considerable amount. So that's the strategy. Now let's dig into how we're doing that. First, it's a very flexible benefit. So no matter where an employee is in regards to technology and how they use it, or if they don't use technology and they still use an old school phone, they won't have any problems accessing a physician consultation via video again or telehealth. Our platform is designed to bring the commonly used endpoints of healthcare in one place. So you've probably seen there's some separation right now. If you jumped into maybe a specific carrier's website, other tools that are out there, they tend to be spread out. So we're bringing all of these things into one experience to make it easier for the member to find each tool, and then of course also keep our offering top of mind. Right? So Pat, as he always says, and I love what he says, telehealth is something we do, but it is not who we are. And that's really important, because if that was the only thing we did, it'd be a lot harder to drive that higher utilization that we've been experiencing as of late. So now is an amazing time to basically be selling this benefit. Deloitte released this study last year. The industry ended up hitting about 1 million consultations, and they're expecting that number to increase by 300 times within the next 3 to 5 years. So we're at the beginning of a very extreme growth curve, which is of course exciting for everybody. And I think we know all the factors, right? It's harder nowadays to get to a primary care physician for an acute illness than it's ever been, right? Average wait time is a couple of days. If you don't have an established primary care physician relationship, the average wait time is about 19 days. Average urgent care wait times now sit at about 1 hour nationally, emergency rooms slightly higher. All of these things are causing some major challenges to the consumer, and unfortunately driving people to a more costly care center than they're accustomed to. And that's where we can really help and play that pivotal role. We're going to talk about that more as we jump through this. So everything we do is designed to have that member start with us for all those reasons we know, right? As Pat mentioned, most of our plans feature a $0 consultation fee. That's a big one because right now the market's not ready to pay, say, a $40 consultation fee or a $30 consultation fee. Members are creatures of habit, just like we all are. So when they're looking at options and they're told, well, you can call this number, but you have to pay $40 before the doctor speaks with you, or you can go in person, and maybe the copay is, say, $60. They'll pay the $60, or they'll pay because that's what they're accustomed to. So by making it free, we're really enticing the member to say, why don't I try this? It doesn't cost me anything, right? I'm not out of pocket. It's worth a shot. It's a really nice thing to not have to sit in a room with other sick people or have to leave your house or leave work. If, again, you're selling to fully insured, claims-rated, level-funded, or self-funded clients, no claim ever hits the medical plan. Great potential for savings, and we're going to talk through that more later on in the demo. And I think that really important piece, this is available 24/7, 365 in every state except for Arkansas. So if you're traveling anywhere else in the U.S., you're not by your house, it doesn't matter. You can still call. You don't have to worry in-network provider in another state. It's just a very, very simple benefit to utilize. So what do we generally help with? Well, primarily it's acute care, but we can handle hundreds of things over the phone. We've had employees call for things they didn't expect to have help with. One had mild, like he sprained his knee, wasn't sure if he had to go in, decided to call HealthiestYou first, and they were able to actually find out over the phone and through a little stress test that it was a mild sprain, no need to go in. Another for some terrible back pain, and she thought she had kidney stones. So they were going to go to the emergency room, and he decided to call HealthiestYou, and they determined that it was a virus, and ended up working itself out in about 3 days. So I just want everybody to know, the way I frame it usually is if it's not an emergency, start with HealthiestYou, right? Now, if you need stitches or you need something that's potentially harmful or addictive, that'll be outside the scope. We're not designed to replace that primary care physician relationship. We're designed to work right alongside it. That's real important. So a little bit about the physician. As Pat had mentioned, the network is great, and we're really excited about the quality of the network with Teladoc. So every single doctor in the network is board certified and NCQA credentialed. Of course, they're all licensed and residing here in the U.S. And again, they can diagnose, treat, and prescribe medication via that consult, but will not prescribe anything potentially harmful or addictive. And we already talked about the access, very accessible benefit. What we do know is that a virtual consult via telehealth or a video consult, you can handle over 70% of your needs because the 70% will fall under that acute illness area. So which is why we want folks to start with HealthiestYou first. Satisfaction is still through the roof. It has been for years. So really, we know that if you get somebody to try it just one time, more than likely they're going to use it again and again, right? They'll tell their coworkers about it. Of course, it increases utilization as the longer HealthiestYou stays in place within that client. Plan savings is a big one, and we're going to get into that further, but we've got some data from a Harvard study that shows some tremendous plan savings. Again, depending on how your client is funded, but we can talk to you at least about what the savings would be to the employee or to the client and what that means from an ROI standpoint. Most calls are resolved in one phone call, meaning if I called and I wasn't feeling well, after one call, my issue is resolved. There are 6% that'll fall outside of what we can do. So again, if I called because I think I may need stitches as one example, or I'm suffering from chronic pain, or when I called, I need to have lab work done, that's going to fall outside the scope of what we can do virtually. Retention's extremely high because, of course, we have that higher utilization model. As Pat mentioned, we live to drive utilization. That's what we're all about. And it's a combination of client success. It's a combination of our great technology, innovative features, but also everybody on the call. Because the more you engage your groups, ask them, hey, what's happening with HealthiestYou? What's the feedback been like, right? What can we do to help? The more we all work together, utilization can only increase. So it's a team effort for sure. Callback times right now, since we've rolled over into the Teladoc network, have actually been at 8 minutes. So the callback times are extremely fast. Another great thing to know is that there is a ton of room to scale within the Teladoc network, which we're very excited about. So as you're selling business, we're built to grow and grow and grow for years to come. So don't have to worry about the callback times ranging too much because we're already built to handle a lot more than currently is in place, which should give you some confidence when selling the product. All right, so let's talk about client success. Again, I can't stress enough how important this is. Traditionally, let's talk about, if you think about an embedded model, right? So you sell a health plan and they have a virtual consultation feature embedded in it. It could be a competitor's product, could be something the plan has built. They all struggle with the same thing, and that is extremely low utilization. So generally, it's something that is just part of the plan, but it's not really there to change behavior. So what ends up happening is you get some pretty low utilization. It'll range from about 1 to 4%. And again, there's nothing wrong with that. It's just a different strategy, right? They come at it a different way. So when we actually sell against the embedded products quite often. They've had some really, really good success. Additionally, client success plays a pivotal role. So again, if you're going to sell the product and say, all right, talk about it during your open enrollment meeting, but that's the last the employees hear about it, you're not going to have great utilization. So what their role is to help in every way possible. So they reach out to every group on a monthly basis to make sure that HealthiestYou is a success. So they're asking how they can provide support. All those things I mentioned, custom webinars, they can record webinars, they'll have some great marketing pieces to send via email, a lot of different things they've done to help drive usage. There is no one right way, which we all know. Every group's a little, so they'll find the strength of that group as far as communication, and they'll piggyback right off of that and then work with them to provide any support that they can. We still send just an old school fulfillment kit. So the really important thing here, none of this is needed to use the service. So you may be accustomed to an insurance product where the member has to have the card and they have to have an employee, or like their member ID, if you will. Where we come at it a little bit differently. Our initial communication will be sent via email. And literally it's just saying, all right, employee, go to the HealthiestYou smartphone app or go to the member portal, enter in your last name, your birth date, and your zip code, fill out some information, and you're ready to go. So they will not need a member ID. They won't need this card. This is just there as a reminder of the benefit. So we'll actually send this out after their effective date. So we hit them once with an electronic piece, and then we're going to get them again with this physical piece right to their home address. This goes to each employee. But it's a different strategy, and that's because we work with the group throughout the year instead of just at open enrollment time. So if you're wondering what that's about, that's why. This is just another addition for us. Some examples of digital marketing. Our marketing team has done an amazing job of creating things that are attention grabbing. One thing that's fun about what we do, the more people use it, the more they save. It's a little bit different than most products out there in the benefits world. So we've done a lot of great things that are seasonal. And it's one example of a back to school season poster. This was an email piece, of course, but this cute child picking his nose, but we're reminding the members that back to school season is around the corner, right? Think about HealthiestYou. We do retargeting ads through browsers. The member portal, they'll see a reminder that they have the HealthiestYou benefit, and we're going to show them all the things you can do as a HealthiestYou member, right? Again, just driving them to HealthiestYou whenever possible. We've done some physical pieces for groups as well, so we'll create PDFs and we send them out. As you see, we have some fun with them. And I like this one. This was actually a self-funded plumbing company. So our team will find ways to really engage those employees, keep them thinking about HealthiestYou. I'm sure some of you have written All Savers cases. So we've gotten really creative with the All Savers plan. Of course, we're included with that. And just a few examples of some different things we did to get the attention of groups. So again, we were pretty outside the box, and we're not afraid to do something that's fairly unique. So in one example, we sent one flip-flop to a block of group administrators within one specific market. And we let them all know, if you register for our upcoming webinar to learn about HealthiestYou, we're going to send you the other flip-flop. We did the same thing sent them a piece of paper in the shape of that pizza. And it lets them know, if you register for this webinar, lunch is on us, right? So while we're chatting, it's almost like a lunch and learn. Or the secret sauce campaign using Tabasco sauce. So these are just some examples. Now, in your commercial block, the standalone business where the employer is electing HealthiestYou, we haven't had to go to these lengths, but I show this to you all just so you understand that we do some different things to make sure utilization is phenomenal. So our value prop, right? Most of our competitors in this space will average anywhere from 1 to 5% utilization. How that's measured is number of consults divided by number of employee life. So if you had a 100 employee life group, you'll see 1 to 5 consultations in an entire year. So that's always been the challenge within our space. We average 42% on our entire block of commercial business or standalone business. Now that's our overall block. If you look at how it's staggered, year one, we average about 25% utilization. Now we all know behavior change takes some time, right? So what's interesting is year two, clients that have had us for at least 1 year will average percent. utilization. So we'll generally see the number double from year 1 to year 2, and then year 3 will pick up another 50%. So that same group that started at 25 would end up being at about 75 to 80% utilization after 3 years. That's the difference in what we bring. We know that if you stick with Healthiest You, we always look at it like a 3-year strategy. You will see great results by the end of that 3rd year. And again, right now over half of all employer groups in the country are offering telehealth somehow, right? So it's only going to gain more momentum. Now is an awesome time to get it in there because this will be part of everybody's plan eventually. So why not start the habit as we're starting out now? All right, I want to walk you all through our smartphone app here. Now, real important, again, our app is designed to complement what the client success team does. So they're really the pivotal piece to what we're doing to drive utilization, as we all know. But without them, we couldn't get people to an app that's chock full of really great features. So I'm going to walk you through all those. So the first thing you see is we've got some commonly used tools in what's called Our Today page. All right, so a virtual consultation up top. You can actually find a doctor that's in your area for an in-office visit, and you can also price out prescriptions. And again, we're going to go through each of these in more detail. As you scroll down, you'll see some funny quotes, comments, and then some wellness content at the bottom. So it's not a platform, but we're showing the members some interesting videos and articles that may interest them. And of course, you can scroll through these videos to see different options as well. Now, we're building out a lot of integration with Teladoc, which you'll see some things down the road to greatly enhance the current member experience, and we'll be sure to keep you all posted on what's coming down the pipeline. All right, now getting into the good stuff. So my favorite is called Radar. So Radar is a virtual map of your location and all of the points of care in your area. Now, these are going to range significantly from doctor offices, hospitals, these urgent cares, and even veterinarians. Now, we're using this with the devious intent of steering somebody to a telehealth consult whenever possible. So in one example, you could say it's Sunday evening, right? It's 11 p.m. My child is sick. I'm accustomed to going to an urgent. I come into the Healthiest You app to look for urgent cares around me. These are the urgent cares in the area. So I see I've got an option just down the street from where we are. So I check that out. It's called Desert Ridge Urgent Care. Let's check details. So the first thing that happens is we're a member to ensure this is an in-network provider. As we all know, that's extremely important, and you always have to call because there isn't a list anywhere that's 100% accurate. So this is just a reminder to make sure they check that because this is purpose only. After that, we're going to remind that same member that they can actually call the doctor instead. Why not give the doctor a call versus waiting in line, waiting with sick people, right? Having to leave the house and so on. Right now, 60% of our consultations coming from the smartphone app are coming from this reminder. Now, we remind people in a lot of different places through the app because, again, right, we're steering everybody to that virtual consult. But it's actually working. So, members are, again, they're following routine. They're coming into our app to find an in-office option, and then a reminder that they can just do something over the phone instead. They tell how we steered them to a telehealth consultation. Now, if your need is indeed urgent, you touch the green button, and that'll call that urgent care location, and you can confirm wait times, network information, right, the important things that you need. Now, additionally, we can help that member find some more interesting things. So let's say, as an example, that I'm looking for a primary care physician in my area that's in my. We currently sync with over 180 payers, plans, and TPAs. What that sync allows us to do is to know which plan the member has. So the first thing that happens is we can help them map out in-network care with 90% accuracy. And as I mentioned before, nothing's 100%, but we do map it out with 90% accuracy. So instead of having to log in anywhere, you can just come right to the Healthiest You app, search by network. So these would be all the primary care physicians around me that are in my network. And if I select any location, I can take a look at the doctor's information, where they went to school. They have a star rating, so that's based on malpractice history, practicing medicine, credentialing, and so on. But again, it's a lot easier way to find that. And I always get a kick out of vets. Look at all the veterinarians. This is in the North Phoenix area, right on the Scottsdale border. Generally more vets here than doctors. But anyway, it's a great way, again, keep our benefit top of mind. Make it simple for the member. So next piece, top providers. So I'm sure some of you have used OpenTable. And OpenTable does an awesome job of showing you basically the restaurants around you that are searched by your criteria, meaning if you wanted to maybe Chinese food and you were looking for a specific price and so on, they'll show you that based on the top rated restaurants in your area. Same thing happens with our top provider search. This isn't specific to the, but as an example, if I said I needed to find, maybe I'm looking for a pediatrician within 10 miles of me and I update my search. So you see one thing down here. Remember, you can call the doctor, right? So again, we're reminding somebody they can call the doctor instead of going in. But if they want to go in, here's an option. So Dr. Schnitzer, 5-star rating with Better Doctor, some information about the doctor, practice location, so I can call again to confirm that network information, and then any background information. So again, just some nice information to access through our smartphone app, steering members to a virtual consultation. Prescription pricing, I love this tool. So if you have any groups, really, I mean, anybody can use this. So what our tool does is it shops multiple pharmacy benefit managers and will show the member the lowest cash price available in their area. And if you're not familiar with pharmacy benefit managers, negotiate a lower rate between a pharmacy and the maker of the drug. And then that rate's in place for a specified amount of time. So it could be they say, all right, Target, we're going to negotiate a $4 cash price on amoxicillin for the next month. What's interesting now is they've negotiated this rate so that Target picks up foot traffic, but the rate's not advertised anywhere, which is still a mystery to me. If you go to Target, there will be a card on the pharmacy counter, and that card has a code, and that code pulls up all these different discounts. But if you don't know what that card is, you won't pick it up. And you might go there and say, all right, I've got my insurance plan is a $15 copay on amoxicillin. Although this card would have brought up a $4 cash price, you're going to pay $15 instead. They're not going to stop you to remind you that you have a $4 option right next to you. So what this engine does is it shows you those rates for you. So let's look up amoxicillin. Now what's interesting is we have a real-time feed with multiple PBMs. So these rates change even throughout a day. But we'll see the lowest 6 options around. So you see there's Walmart. Okay, so Walmart's currently at $4. So if Walmart's an option that's close by, I select Walmart. I can show the pharmacist this information. That'll pull up their coupon, right? Because it's their coupon they've negotiated with the maker of the drug. Now, on an iPhone or Android device, you can show them this screen. On the iPhone, I can also add this to Apple Wallet, and that'll bring up the scannable barcode. But again, the really nice thing is this will beat the average copay 70% of the time. It's an awesome option if you're on a high deductible plan, but I always look at it as just a cash option. So you pay cash, you save some money. And I was mentioning that, a lot of employees nowadays are on a high deductible plan where most won't hit their deductible, right? So a lot of the cost is shifted to the consumer. They can actually use our prescription drug tool to save some money. If you're like me, I pay cash for everything because I have a high deductible that I'm not going to hit. So if this beats, anything else, I'm just going to pay the lowest cash price available. So an awesome option for really any plan, but especially any plan that features more cost passed along to the consumer. All right, procedure pricing. I know there have been some really nice tools within some of the carrier plans out there or their websites, but I don't know how many people are using those just yet. So what our procedure pricing tool does is it estimates cost based on real data within your zip code. So as an example, if I need to have an MRI done, right, so I've gone to the doctor, they said you need an MRI, I've been referred to the next specialist. I don't know what I should be spending, but I'm always in the habit of, well, I got referred here, I'm just going to pay whatever they say I should pay, right? I don't even think about checking this. Well, what we're going to do is help the member understand what they should be spending to make sure they're not overspending. So we aggregate all the data by zip code, right? So let's say on an MRI, I'm thinking about paying cash. I want to know what I should be spending. So in North Phoenix here, I'm in 85054. The cash price on average is $857.51. Now the low and the high numbers, those are real, those are accurate. Okay, and the average is also accurate. So what that tells you is more people have paid, a little bit on that higher side, but some have paid $350 in this zip code. So if you look at the difference, it's almost $700 variance in one zip code. So now I understand as a user of healthcare that I should be spending around $857. If I'm up in that 1,000 mark, I'm definitely paying too much money and I better shop around, right? So now if we jump back, we can do the same thing on the insurance side. Now on the insurance side, this gets a little, now we can search by CPT code. So we find a procedure again on the MRI side. Now some of these tools, or these options I should say, won't be available in your area because of course not every procedure is available in every zip code. So in our smartphone app, we use the phone's location to determine rates and options around you. In our member portal, you can shop using zip code. So if you are in a rural area but you want to drive 30 minutes to a city nearby with more options, You just throw in that zip code and it'll show you what you should be spending within that zip code. So there are some other options if the app is limiting you in any way at all. So let's say we need to have we'll say a brain MRI. All right, what's been paid? Now, just to be real clear, what insurance is doing on our search is it's averaging all of the network discounts within my area. Averaging every carrier that's in Phoenix, which are a lot. But at least it's giving me, again, a ballpark of what I should be spending. This is a cost estimator. So you see the low stayed pretty flat, but the average and the high dropped considerably. The average now went down to $485 from over $800. So now for me as a consumer of healthcare in this area, I'm understanding that I'm better off using insurance because the discounts are so strong here. Even though for me, again, I'm on a high deductible plan, I'm out of pocket either way, but definitely should be using insurance to save myself some money. And this will vary by zip code. I've been traveling a ton, and every market I go to visit, this changes. Some markets cash is much better, some markets cash is much worse. But it's good to know what your options are, right, as a consumer of health. And cost estimation there, but a really valuable tool. All right, next up, check insurance. Now, if we sync with the member's insurance plan, which we won't sync with everybody, but if we sync with their plan, we're going to show them a few things that are very useful here, and HR team members like this one. So you have your insurance card at the top of this screen, a real-time deductible balance below. So again, we connect via eligibility, a feed via eligibility on this side of things. So we know what your insurance plan information is because the member inputs that when they download the app. We can also tie that right to the carrier for deductible balance. So the second the carrier files the claim in their system, this app will update real time. That's a real-time feed. So I'm sure you get, employees have the question for HR all the time. What are my copays? What is my deductible balance? What is my deductible max? They have all these questions. Now it's all available just right in the HealthiestYou app. What plan you have, when it started, if it's active. If you're on a copay plan, summary of benefits here, and then you have any limitations to the plan there at the end. And you see for me, network not applicable because I'm on a high deductible plan. So I know I'm a boring example there. And then lastly, a recipe lookup tool. So last are the features. Now again, the reason we do all these things is to keep us top of mind. So you might have somebody that loves to cook, but they don't care about some of our other features. That's okay. If they come to our app just to find recipes, they're thinking about us. When they're sick, they'll think to call HealthiestYou first. So the way this works is I can say I'm looking for breakfast, and maybe today we'll be gluten-free today, and I would like American cuisine. Update my search. So using that search criteria, I now see options that match. So you see we've got some different things. If we look at these breakfast muffins, these are gluten-free. So here's how to make them, the ingredients that are needed, and then nutritional content. Now everything can be saved for the app demo, which is called Circles. Circles becomes every member's personal healthcare ecosystem. So anything they find from all specialties can be found. So dentists, eye doctors, PCPs, pediatricians, veterinarians, recipes, prescriptions, all of that can be saved here. So instead of having to find them again, I can just jump in here and say, all right, I need to schedule a well visit with my primary care physician. You find the info, give them a call, off and running. And again, this can always be edited. So some really nice tools there to keep somebody coming back to our app, keep our offering top of mind. All right, let's jump back to the demo. So a couple of things I can't show you within the smartphone app. First is, every smartphone nowadays has GPS functionality. Now I understand some members may turn that off, some may keep it on. We're using that GPS functionality to know where that member is and catch them at their time of need. So as an example, if it's 11 p.m. and I totally forgot I have HealthiestYou, which will happen, right? I've downloaded the app, and I downloaded that app 4 months ago, and this is the first time I haven't felt well, so I'm taking my child to an urgent care. Once I get there, the app will send me a benefit reminder alert saying, hey, it appears you're at an urgent care, Jesse, but remember, you can call HealthiestYou for diagnosis and treatment right from your phone instead. Okay, that sounds like a good idea. So I can actually be at the urgent care while I'm waiting to be seen there, get a call back, have everything done before I visit a doctor in person, right? So now we've just caught that member at their time of need. We're changing their behavior because we've steered them to a telehealth consultation, and we've kept a claim away from the plan, right? And or saved the member money. So just some great ways to keep our offering top of mind. We do the same thing on the pharmacy side. So if a member goes to a pharmacy, they're reminded that they can shop our engine for better rates, right? Cash prices for those prescription medications. Now, importantly, we understand that some members don't want reminders, right? If they don't, that's fine. They can actually turn these off within the preferences of their smartphone app. So they always have that option. We're not trying to be Big Brother by any way. We just want them to understand their benefit. And we want them to understand when they can use HealthiestYou, again, keeping it top of mind. All right, so let's talk about savings. So if you are in the self-funded market, the ROI potential is unlike anything else you'll see. And what I mean by that is anytime somebody calls HealthiestYou, right, the second they call and have a consultation, we know we've just saved the plan money. Now, wellness platforms are also great, but they focus more on the very high-risk items. We're illnesses. I've had a lot of questions around that. Well, if we want to share data back to the group based on why are people calling HealthiestYou because we want to reduce risk, we're not in the risk market, right? We're in the you're going to have an acute illness market. We're going to help you. So those things work together extremely well. We'll keep out the little claims. The wellness platform can keep out the big things. But every time somebody calls, we know they save money. Now, I mentioned that Harvard study earlier. What a Harvard doctor found was that anytime somebody uses a virtual consultation option, on the very low end, it saves the company $670 by redirecting a claim, and then another $47 are saved by reduced PTO time being paid out. This was an extensive study done with one of the largest home improvement stores in the country. Okay, so many different plan types, different carriers, a lot of data to go around. We also know that on the very high end, $2,900 is saved, meaning somebody's probably going to an emergency room because they have a fever, which I've seen claims around that are up near $5,000. So it doesn't take long to create an ROI using HealthiestYou. That's my overall point. The study, if you're thinking about, well, how can one visit cost that much money? Well, it wasn't about a visit. What the Harvard study really zoned in on was the path of care, meaning if I went to the doctor on July 1st, how many other visits did I have with that same doctor for follow-ups, and then what did the actual costs become? That's where the larger amounts came in. We used 510 to be conservative because we know we can always justify 510 because it's actually lower than the Harvard study. So if a group of 500 employee lives hits our average of 25% utilization year one, right? They've actually just created savings of $27,750. That's after paying for HealthiestYou. And of course, if they hit then that 58% number, right? So they've had us for at least a year, the savings after paying for us is tremendously higher. Again, there's nothing like this in healthcare. If they're self-funded, the more we can keep the claims out of the plan, we all know, the more we can help out. So it's a great way there. I'm going to show you some data here. I've got a dashboard. So I also, we want to be very transparent with data, understanding that if our value prop is they're going to use HealthiestYou, we better show that, right? So every single client of ours, regardless of size, has access to our client portal where they can view consults. So I'm showing you an annual report from actual group last year. But you see they had about 1,023 lives. They hit 41% utilization year one, which is awesome. These are the claims that were redirected, right? When are people calling? Pretty common that we see a lot overnight and late afternoon, not so much in the morning. Top 5 complaints, prescriptions. This was a multi-site group, so where are people calling from? Important for the HR team to know because if one location is a little behind, well, why is that? We can find out. And then every time a member calls, they're asked if you didn't have HealthiestYou, right? So if you didn't have HealthiestYou, we're going to show savings to the plan down here at the bottom based on some very conservative estimates. So a lot of great reporting right back to the group. All right, so fully insured claims rated. We've also had some tremendous results there. This is a school district in Wisconsin. Their first year with HealthiestYou, they hit almost 87% telehealth utilization. Now, they did a really nice job with our client success team, their consultant, to raise awareness. And I'm telling you, if you work at it, it will happen. But what happened was they redirected enough claims out of the plan that the renewal actually dropped 2% going into this plan year. So yes, we may not save right to the bottom line every time somebody calls, but we're saving the employees money, we're saving the employees time, we're keeping them at work, which helps the group, and also impacting a renewal. So some great results there. And again, self-funding, I think we get it, but there's another strategy that some of our consultants have implemented, and that is a plan change within the self-funded strategy. So this consultant had a group that was really struggling with urgent care spend, a regional plumbing company. Every employee was just conditioned to, if I'm sick, I go to the nearest urgent care. They're on the road all the time, right? Creatures of habit. So what he did was he jumped in, raised the co-pays and the deductibles. right? So now we shifted some of the cost to the consumer. Use the plan to steer members to HealthiestYou. So in addition to everything we're doing to raise awareness, he changed the plan with some awesome results again. So after he did that, the next plan year, their utilization hits 44%. So first year with HealthiestYou, urgent care spend dropped 37%. So needless to say, that strategy paid dividends for everybody involved, for that matter. Now, if you're on the fully insured, or the age banded groups, right? So claims experience doesn't help you out. We're really there to do two things. We can help the employees and bridge the gap to care. In addition, save them money and keep them at work, right? So the basic premise is you've got your major medical plan for the catastrophic needs, right? But you've got HealthiestYou to handle the 70% of the reasons you're going to the doctor in person, and all those can be done over the phone instead. So anytime you can call HealthiestYou, we're going to save you some money. But if something bad happens, you can use, right, the catastrophic side of your medical plan. Now, what a lot of our consultants are doing is they're taking the plan, they're restructuring it to create enough savings to pay for HealthiestYou, and then additionally sell other products that will help the employees of that group specifically. And what that does is, of course, will help your revenue as well, because you earn commission on HealthiestYou and of any of those other products. And while you're doing that, you're actually helping the group, you're reducing their costs, and you're helping the employee because some of the cost has probably been shifted to them. So that strategy has been working wonders for a lot of our clients out there. And I think Pat had mentioned, but we're in a lot of different markets. What our team at HealthiestYou is going to focus on is helping you all sell business, right? So we're talking about working with the groups, helping sell HealthiestYou right alongside that major medical plan. And that's what we're here to do, is just support you. We don't do anything directly. You are our lifeblood. So anything we can do to provide assistance, that's what we're here for. Great. So we have two options. About 99.999% of our plans are employer paid, $0 consultation fee. How these work, so if you were, as an example, if your sweet spot's 100 to 249 employee lives, that PEPM is $8. The $8 includes 15% commission to you, the producer, and that's paid residually, just like a major medical plan. The really nice thing is we are a lot easier to enroll than an insurance product. There's no underwriting. So all you need to do is send us a census and a group enrollment agreement, and we're going to take it from there for you. So the one thing I can't stress enough is this is very easy on the implementation side for you. You don't have to worry about underwriting or a long wait time. It's a very seamless process. Now, if you have a group that really likes the concept of HealthiestYou, but maybe they just don't have it in their budget, we can be offered on a voluntary basis as well. Like I said, most of our plans are employer paid, but if you wanted to use that option, an individual would spend $11 per month for unlimited use, no consult fees. A family would spend $15. And we think that market's going to grow, but again, a lot of what we do is on the employer paid side. And we've got a great partner portal. So what we're going to do is, everybody that's joined the call today, we'd love to get you into our partner portal. It allows us to do a couple of things. It's really there just to help you. You can create your own proposals. We've got all of our marketing materials. Enrollment forms are there. As a consultant in this world, you can jump in there at any time to view what groups you've sold. If you sold to any individuals, we have an enrollment site to register individuals there. They can pay with a credit card or debit card. You can view commission statements. So all of this is accessible in one site, and we're going to continually enhance that going forward. So we'd love you all to be a part of that, and our team will be reaching out to follow up with everybody on the call, and we'll get you a partner portal account as well, because that's only going to help you sell HealthiestYou. Additionally, we're going to send you a monthly email to let you know about what's new, or we'll send you an email when anything happens, right? So as integration's built out with Teladoc, we can keep you all updated on what's happening. So please use that resource. It's an awesome tool. We also offer up a 30% discount as a HealthiestYou partner. So if you go into our website, you can use your credit or debit card and buy a membership 30% off of those voluntary rates, and then use the broker support team. Like I said, our only job is to help you be successful with our product. We'll work together to close business together, grow our businesses together. That's what we're here for, and we would love to do anything we can to provide assistance. All right, lastly, we're giving away an Apple iWatch today, which we're going to draw shortly after this call is over. So please keep an eye out for an email where we will be announcing the winner. Thank you all for your time. So I know you had a lot of questions. Our team will be reaching out probably over the rest of today and tomorrow to say hello, introduce themselves if you're in their territory, and get those questions answered for you. And again, we appreciate your partnership. We're looking forward to a really exciting Q4. A lot of great tools and integration on the way, good features for our members. and there's never been a better time to sell Healthiest You. So thank you all again, and have a great day.